So, who knows what month this is? This month is Endometriosis Awareness Month. And as always, I like to give you guys the best information. So, we're going to be discussing endometriosis this month. And I want to tell you important things you need to know about endometriosis. So, these are 9 important things I want you to know about endometriosis. So, first things first. Endometriosis is more than just period pain. Most times people just assume that when you have endometriosis, you have painful periods. But I'm here to tell you that it's more than that. People have pain when they're passing urine, they have pain when they're passing stool, they have pain in other parts of their body, they have abdominal pain even when they're not menstruating. They can bleed from their navel, from their rectum, from their wound. They can bleed from anywhere. These are other symptoms of endometriosis. So it's not just about painful periods. This is very important. Endometriosis can affect fertility. And so anybody who has been diagnosed with endometriosis, I usually tell them you can't say you are waiting. The earlier you try to get pregnant, the better, so that if you can't get pregnant, then we can still try to help you get pregnant. So yes, endometriosis affects fertility, but I'm not saying that everybody that has endometriosis would not be able to get pregnant. No, but endometriosis for some is the cause of the infertility. Now, the symptoms vary from one person to the other. So you can't say, oh, this person has endometriosis and she bleeds from her navel. And because you are bleeding from your rectum, it's not endometriosis. So understanding where the endometriotic deposits are is what differentiates the symptoms. So the symptoms of endometriosis can vary from one person to another. That's one. Second thing is that the severity of the symptoms can vary. So somebody may have menstrual pain that's relieved by painkillers. Another person may have menstrual pain that you require very, very strong painkillers to try to give some form of relief. Now, this is another very important factor. Endometriosis, it usually takes years for it to be diagnosed. So you have people going in and out of the hospital every single day, every single month, and then the diagnosis is not made. Why? Because at times the symptoms of endometriosis are similar to symptoms of other conditions. So usually it takes a while. One is either misdiagnosed, underdiagnosed, before eventually the diagnosis is made. Now, to diagnose endometriosis, a procedure called a laparoscopy is usually done, whereby cameras are put into the abdomen and then you see the endometriotic deposits. Now, laparoscopy is a bit expensive. Not everybody can afford laparoscopy, and this is another reason why diagnosis is delayed. This is actually very sad because a number of people have endometriosis. There is no cure for endometriosis. Your treatment basically is just to prevent progression of the disease, treat the underlying symptoms, prevent complications, help the person get pregnant, but you cannot treat endometriosis once a patient has been diagnosed with endometriosis. So anything you're trying to do is to manage the condition. I need us to understand that. Now, hysterectomy is not the solution for endometriosis. At times people feel that, oh, it's because I have menstrual cramps, so let's take out the womb. If you take out the womb, the symptoms will stop. No. At times they say, oh, okay, because the hormones are the ones that, make one menstruate. So if you take out the ovaries, you don't have those hormones again, and so you're not menstruating from the endometriotic deposits. That sounds like, it should make sense. That should actually stop the process. But at times, the disease has progressed has caused complications, has caused adhesions. And so if you take out the womb and you take out the ovaries, for some, they still have that chronic pain. They may not have pain during their periods because they won't have periods. They may not bleed from any other orifice, from their navel, from their rectum. They may not have that. But for those that already had adhesions from endometriosis, they may still continue to have pain from that. There's some things that we can do to reduce some of the symptoms, yes. So for some very lucky ones, diet, lifestyle modifications and all that can help to reduce some of the symptoms of endometriosis. Now this is important for me, and I sing this song every time. Painful period is definitely not normal. Nobody should tell you that, oh, my periods were like that and I'm fine. They are fine. You may not be fine. There are so many causes of painful periods, so we should not just assume that my cause of painful period is also your cause of painful period. So if you're having severe painful periods, please see a specialist. If you see a specialist and your specialist makes you feel like your pain is normal, please seek a second, a third, a fourth, a fifth opinion. It's your health, it's your body. But you should not continue to live your life in pain every single day because you are a woman. Endometriosis is not your fault. There's nothing you did about it. For some people, there are things that cause it. For others, it just happens. For others, it's genetic. It's not your fault. And so you should not suffer in silence.